Welcome everyone. Welcome to this webinar organized for the ESWA Congress this year that is in virtual edition. I would like to thank you very much for joining us on this important event where we are organizing 3 different educational activities. And so we are very pleased to have you here today. My name is Luca Mastrogirolamo. I'm International Clinical Support Manager, and I'm very pleased today to facilitate this event for you. We are honored to have today Dr. Claudio Celentano from Italy. Dr. Celentano is a gynecologist. He's working in the Chieti Hospital. He's also running a private practice. He's very experienced in fetal medicine and has a very long expertise in ultrasound scanning. Today, he will present us a lecture that is entitled Early Pregnancy Assessment with the Use of the Novel CMUT Linear Transducer and Insight on Surface Abnormalities. Right after the lecture, there will be a Q&A session where you can place all your questions and Dr. Celentano will reply to all the questions that you will place. So I'm very pleased to introduce Dr. Celentano. And I would like to thank him very much for his availability to join us on these educational activities.
Thank you very much, Luca. It's really a wonderful opportunity having this time together, talking about a beautiful topic that is early pregnancy assessment and the use of these new technologies that industries are giving us in OBGYN. It's really important for us coming a little bit back on what is our job. Our job was starting in obstetrics with the identification of a problem in a pregnancy. We have to recall that early in the 70s, the screening test using alpha-fetoprotein for neural tube defects. This was the main topic in that time, giving us the opportunity of understanding malformation, syndromes, fetal problem, and giving the opportunity of a good counseling for parents for the future of the baby, for understanding what the baby has and what is possible or is better to do during the pregnancy. Ultrasound was adding a lot of information. In the early 80s, the ultrasound scan was able for, in neural tube defect, able to understand the problem together with alpha-fetoprotein and much better compared to the alpha-fetoprotein. And for us, for gynecologists, for perinatologists, was important giving time to the couple for understanding the problem, for giving to the couple the opportunity of understanding the problem of the baby and having the right choice for continuing or termination of pregnancy. This work was really interesting and was really important in obstetrics, and we have a lot of paper in 80s and 90s understanding the morphology of the baby, understanding the time for a good morphology scan, or the time for understanding a problem on the central nervous system, on the fetal heart, and so on. Guidelines was important for understanding a lot, but risk calculation, this morphology sequence, genetic syndromes associated to morphology scan. This is helpful for our job, and this is important for having a safe diagnosis and an accurate diagnosis. And it's important to us the knowledge of our limitation in prenatal diagnosis. It's not simple, but you know, sometimes having a late diagnosis is not suitable for termination of pregnancy. or sometimes we have a diagnosis that is a little bit late, then we cannot give enough time to the couple for understanding what is happening. Then sooner is better was the motto for obstetrics. Starting from knuckle translucency, risk calculation, we were working a lot for understanding the fetal pathology as soon as possible. Even though this is not simple, because sometimes we have pitfalls, we have false positive, false negative. And we have also the dilemma of miscarriage deriving from procedures, and much more the dilemma deriving from medical error deriving from false positive analysis. Kypros Nicolaides, starting with the topic of knuckle translucency, was inverting the normal perinatal care that was possible in that time. From the beginning, we thought that, okay, first trimester, few information, less important scan or analysis or check on the patient, and much more stuff for third trimester and close to the delivery. Nowadays, we have an inverted pyramid, and this is important because in this way now, and this is normal in our time, and this topic was in the early 90s, we have a lot of effort on first trimester scan, on first trimester physiopathology understanding, and in this way, we are able to check which baby is at high risk. And on these pregnancies, we have to put a lot of effort and a lot of cost and spend money and time for these babies. I recall when we were talking about the title of this meeting, I was recalling a meeting in Naples in 90s. Dario Palladini was inviting a very important guy in my life. He was a guy coming from Israel, but in that time was coming from New York. Sharaga Rotem was wondering and was publishing the idea of having more information, more data early in pregnancy, as early as possible, as soon as possible, for understanding what is the natural history of fetal anomalies. He made Iron Fund. Iron Fund nowadays is working. I found out many years later on internet, creating a database. He was talking about putting a lot of data in mass data analysis, machine learning, artificial intelligence, working together for perinatology. Now, 2020, we are normal having this kind of name in our mind. But in that time, think about how is possible thinking mass data analysis in 90s, machine learning. It was a future, it was like a movie. It was really a dreamer, a holy man, maybe a foolish or what else. That was my thought in that time. But many times in my life, I was thinking, maybe we can check something earlier, and having more time, it's important. It's important for giving time to the couple. Our job is giving information, and if we have enough time for giving information, this is better for the couple. Machine learning now, it's normal, I told you, but we can talk about machine learning. We can talk about mass data analysis, because we have industries working with us, industries that are working for giving us high definition probes. And this is not simple. Why this is not simple? Because this is what now is available. It was not available in that time. And this guy was really an holy man. Now we have high quality imaging using the CMAT probe is really nice, is really, it's beautiful playing with this kind of probe, because it's giving us really a clean picture. And we are working with our eyes. Our eyes is our way of having diagnosis. And if we have really no problem with the picture, we can check better on this picture. We can check earlier with this picture. This probe is giving a really high fidelity signal of ultrasound, and the imaging resolution is really amazing. And hopefully I will show you something. Why early identification? This is only a simple presentation of data that now we know perfectly. For example, a genesis of corpus callosum. We cannot see the corpus callosum early, really early in time. Sometimes at 18, 17 weeks, we have no picture of cavum septum, pellucidity, and corpus callosum using the normal probe. But now we know that using the high definition probe, using Doppler analysis, the pericallosous artery is simple to manage earlier than the normal second level scan during the second trimester. Then, if there's a doubt of a genesis of corpus callosum, at 12 weeks, we have a lot of opportunity for having, for example, CVS and molecular diagnosis. In this way, we can give a couple really good information about the prognosis of the baby and the evolution of this disease. And now this is available. Using CMAT, what is nice? We can work in a wonderful way early, first trimester, but not only, also during the second trimester, because we can have better picture during the second trimester. And why not in third trimester? Is really a wide range probe. And this is interesting because we can work with first trimester. This is picture about pericallosous artery. Metopic suture, we will talk about it later on. We can understand better the morphology of the baby. And we are only at 12 weeks. Then we have time for CBS. We have time for talking to other specialists for understanding the problem. We have time for giving information to the couple, and giving information to the couple, it's important for understanding what is the future of this pregnancy. But not only. For example, we can check really an early embryo without increasing. You can check mechanical index and the tissue bone, the temperature, how is not moving using this kind of probe. Second trimester is really beautiful because we can check really the real meaning of soft marker. Soft marker is something that was in the 80s about genetic sonogram, but now we can check better, we can check earlier, and we can have really good picture, simple for understanding for a couple and also for other colleagues. Third trimester, having this wide range of band, we can move also on it. For example, in this way, we have the analysis of pericallosous artery and corpus callosum that we could also use in applying the 3D picture. But you can see how beautiful is a high definition probe in this field when the baby is late. Now we are at 32 weeks. 32 weeks, you can see how CMAT probe is giving us a picture that is jumping out from the screen. You can see this baby with the nostrils, the upper and lower lip, how is the definition. At 26 weeks, the patient was normal, was not so thin, was not so a model in that sometimes it's important to have, but it was perfectly normal. But and we were able to reach this kind of definition. We can have also using the technology that industries are giving us, beautiful picture understanding perfusion of myocardial with the function of myocardial that is simple to understand, giving the this kind of probe. On the left side, you have the perfusion on the splanchnic organ, and what is nice on the right side of the screen, you can see eyelids with cilia, and this is important. This is nice, yeah, but sometimes could be also important. The splanchnic organ, and not only, you see how simple is understanding the movement of the eye for fetal behavior status. This could be interesting, but also sometimes for understanding something different. This is a way for adding many information about the eye. What is interesting, this is a baby, almost a term pregnancy, and perfectly normal, second level scan, few weeks before nothing, and now nothing of really important. We have the knowledge this is a dacryocystocyst, but we know that this is a dacryocystocyst. Why? Because the picture in 2D scan, it's perfectly simple for understanding a dacryocystocyst. Then when we have the baby, you can understand immediately that this is a problem with no malignancy or no surgical problem. This is the spontaneous resolution of the baby from one day to the other. And giving us the information before, we're able to inform the parents that, okay, this is the problem that you can see on the face of your baby, but this is not a problem. This is a problem with a natural solution, with no ophthalmology involvement, no surgical involvement at all. Now, when I told you something before first trimester, we have to know that sometimes we have some problem that are really well known for us in prenatal diagnosis. Treacher-Collins syndrome is an ancient syndrome, is not so common, is an autosomical dominant pathology syndrome that is related to facial dysmorphology. We have a lot of data about second trimester scan with abnormalities of the face. We have a lot of first semester diagnosis. Okay, the mother or the father is affected. He had surgery during childhood. We know the malformation, and we will check with using CVS the diagnosis. This is not a problem. Okay, this is not a problem. We have a couple. She is affected by Treacher-Collins syndrome. She had a terrible childhood with a lot of surgical approach. And from the first pregnancy to the last pregnancy, we perform CVS for understanding the affected and the unaffected fetus. But you know, when you are performing the CVS, why not checking the morphology of the face? The morphology of the face was really interesting. These are the 4 pregnancies of the patient. This patient had 4 pregnancies, only 1 was unaffected. You can see the metopic suture. We have 3 metopic suture of affected fetuses, and only 1 metopic suture of unaffected. And you can see that is quite different. but it's possible to check also the ear that are a little bit different in the unaffected compared to the affected. You can see how the ear lobe is wide open compared to the unaffected one. And this is interesting. Why? Not in this case, because in this case we have a patient that is affected, then we have to check this kind of problem. But sometimes if we are performing a good scan, we have to look far away, and sometimes we can check something better and giving more information, and this is interesting. But we have to say, okay, maybe it's a prophecy, maybe it's a dream, but sometimes looking far could be a nightmare. And it's important understanding, and if we are able to understand, we can give the right information. We are not checking for the future. We are not able to see the future, but sometimes it's important understanding what in the future will be. Thank you very much for the attention. This is my family, and I'm very happy of having this kind of opportunity of talking about something that is the mainstay of my life since I was before a student in obstetric department, after a resident, and now an obstetrician working in my country. Thank you very much.
Dear Dr. Celentano, thank you very much for this lecture. It was really interesting. I think you gave us a very good extent of the possibility of this new technology on early pregnancy assessment. I think it's a very promising technique, and I think that there is a big potential that we can that we can follow also in the near future. Also about the fetal phase abnormalities, I think you show us very interesting images and very nice cases. I would like to thank you very much for your kind availability, Dr. Celentano. It was really a pleasure to have you. And I would like to thank also the audience to be here with us into this webinar. Right after the lecture, there will be the Q&A session. So if you want, you can place your questions right afterwards. We will be happy to reply to you. So thank you very much again for joining. And
thank you very much.
Thank you, everybody. Goodbye.